The issue with methylene blue is that it's a fantastically shocking blue color.
When you take methylene blue, the urine turns blue and the feces sometimes turn blue as well.
Is it safe to take every day? The answer depends. We believe yes, but you may want to take a day off during the week.
The issue with methylene blue is that it's a fantastically shocking blue color. And so as a result of that, we understand that not everybody wants to have a blue mouth. And if you do have a blue mouth, you don't want to have a blue mouth for very long. In essence, this is the deal. Methylene blue is highly bioavailable, which means that whether you dissolve it in a troche form up here, or if you swallow it, best on an empty stomach, you're going to get almost all of that methylene blue into the system and active and available for the body to use. The difference is that up here in the cheek, it's going to be faster. And so if you have more brain fog, concentration problems, attention issues, these are reasons why you may want to think about using it as a buccal troche and not swallowing it.
So what are the risks? What are the possible side effects? The most common ones are urinary and GI, gastrointestinal side effects. So peeing a lot, or sensation of burning when peeing, and also GI symptoms like nausea or diarrhea. Most of these were mild and transient, so it wasn't severe, wasn't a huge deal. Another thing to mention is when you take methylene blue, the urine turns blue and the feces sometimes turn blue as well. It might freak out some people. Another thing that's very important for people who are on serotonergic medication, like Prozac, these antidepressants that are selective serotonin reuptake inhibitors, SSRIs, you don't want to combine methylene blue with that. They can interact and they can cause something called the serotonin syndrome, which is more serious, can have more devastating symptoms, including in some extreme cases, death. So caution with that. For someone who decides to try methylene blue, definitely make sure you're not on serotonergic medication.
Most of the strength for oral methylene blue that literature suggests to be safe, relatively safe, is 0.5 milligrams of your body weight up to 4 milligram per kilogram of your body weight, with the bell curve, the average being about 1 to 2 milligram per kilogram, okay, of body weight. So that's how much they deem relatively safe having in your system. So now we're going to pair that to half-life so we can figure out if there's like maybe a best practice frequency here. In our opinion, like best practice to make sure that residually you don't add up where you end up outside of that 4 milligram per kilogram strength, which is deemed still safe, right? We want to make sure you don't slowly creep up over time. Taking one day off during the week might be the best practice to do that. By taking that one day off during the week, you're going to give yourself essentially 4 half-lives of no methylene blue in your system to break down any sort of residual that you had in your system. Okay, this is going to be a good way to ensure that we don't creep up over time too high where we get outside of that what is deemed safe 0.5 milligram per kilogram body weight up to 4 milligram per kilogram body weight.